Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Recorded.
Hello everyone, welcome to the Prevent Connect Web Conference today. My name is Ashley Klein-Jimenez. Today we're going to be looking at how to build organizational capacity to support sexual and domestic violence prevention. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So I want to introduce and turn it over to the awesome Prevention Institute team, Alicia Somji and Sonia Lockhart. Alicia, I'm going to hand it over to you, and thank you for everything you do.
Thanks for the introduction, Ashley. This is Alicia from Prevention Institute, and with me I have Sonia, who is going to be web teching for us today. Do you want to say a quick hello?
Hi everyone, this is Sonia.
Great. I'm going to start off by sharing our objectives for the day. Now, usually our web conferences are really focused on external strategies that are very content-specific for prevention, and we go through a range of different topics. But I'm really excited today because we're facing more inward in our organizations to really think about how we can build organizational capacity for prevention. And really, all those strategies that we talk about on these web conferences aren't possible if we don't have the capacity to do them in the first place. So today we're going to be identifying critical components for building prevention capacity and going through what those components may be. We'll also be exploring how practitioners and agencies, both at the community and the state level, are building their capacity for prevention. And as you know, we like to do this through our guests that we have. So today we have two sets of guests, one working at the state level and one working at the community level. And as always, we like to engage in candid discussions, and we like to talk about what those challenges really are. So today we'll be talking about challenges in prioritizing prevention in organizations. And as always, we also like to share tools and resources along the lines of the topic. So we'll be sharing those through the text chat, and they'll also be available on the web page for this web conference as well. So as I mentioned, we do like to have lots of discussion. Please feel free to use the text chat at any point, either reflecting on your thoughts or writing any questions. We can't always get to them all, but we'll always try our best. So to make sure we're all on the same page, I wanted to start off with asking the question, what is capacity building for sexual and domestic violence prevention really mean? So what we're talking about is an agency's ability to support and implement domestic and sexual violence prevention efforts. So this doesn't just mean creating a curriculum or a program or finding resources for prevention work. It's really about integrating prevention into all aspects of an agency's work. In order to truly work towards social change and improve communities, we do need to think internally. And this includes internal policies, practices, and the external prevention work that we're all aiming to do. When prevention is integrated holistically, it isn't just the responsibility of one person. It's more likely to be effective and sustainable and better serve the community when, we are integrating it holistically. So we want to ask you a text chat question. Is prevention currently integrated throughout your agency? If so, what are some examples of how your agency has done this? And if it's not integrated in your agency, we'd love to hear that as well, or kind of figure out where you're at right now. So please feel free to respond to that, and we'll come back to the text chat in a few moments to hear what you've been sharing. So many of you have probably heard of the Delta Prep project that took place a few years ago. They selected 19 state domestic violence coalitions to build organizational prevention capacity, and catalyze intimate partner violence prevention strategies within the states. And so through this, there are a bunch of tools that are available. And according to a study that was in the Health Education and Behavior Journal, the Delta PrEP project achieved its capacity building goal with all 9 participant coalitions integrating prevention within their organization and serving as catalysts for prevention activities in their states. At 6 months follow-up, coalitions have sustained almost all prevention activities that they initiated during the project. And so I think that a lot of the tools that were shared through that project are useful even if you're not working at a state level or at a state coalition. So 2 of these things were the step 1, the prevention capacity assessment, which can help you assess where you're currently at. And again, while they were created for state coalitions, I think that there still may be some usability there for other agencies as well. We'd like to go back to the text chat and see if anything's been coming up and how people have been, if you're already integrating prevention in your organization or not.
Yeah, so Alicia, I'm still kind of reading through some of these, but not surprisingly, I guess, there are some folks who are including staff across agencies in prevention, but that could just be giving them prevention education as well, like tidbits about prevention, I think someone said. And then the other thing I'm seeing a lot of is that it's really falling on one department or one program that's really separate from all of the other things that the agency does. And so there's not a lot of integration.
Well, I think that our guests today will be able to speak on how they went from maybe a structure that was like that to expanding further to make it more holistic throughout. So hopefully their lessons learned will be helpful for those of you who are in that situation today. So some components to consider that came from the Delta PrEP project had to do with the components that you currently see on your slide. And our guests will be going into more of how they've considered those in building their capacities. But for a quick overview, it's important to think about your organizational strengths and opportunities within these dimensions. So structures and processes have to do with how an organization formally organizes and operates. Staffing includes training and organizational staffing structures. And also we know that buy-in from leadership is important, whether it's from an executive director, senior management, board of directors, as well as partnerships. You know, we can't do prevention work alone. Coalitions and community collaboratives are very helpful. And something that we talk about in pretty much all of our web conferences, the importance of partnering with even untraditional partners. And of course, we all know the importance of resources in all of this too. So before I move into introducing our first set of guests today, I also wanted to share a tool that Prevention Institute has. It's called the Unity Roadmap, and it's all about building sustainability and effectiveness for violence prevention. Now, the tool is more framed for community violence prevention, but I think that a lot of the lessons apply to multiple forms of violence, and we're also currently in the process of updating this to make it align with multiple forms of violence and update some of the language. But in the meantime, I thought I'd share this since it relates to capacity building and the different things that need to be considered in addition to just you know, programs, organizational practices, and policies, which is often what we think about, like the strategies, but we, you know, it shows that we also need to think about collaboration and staffing, or, you know, getting that high-level leadership. So I recommend checking out the links that have been shared by Prevention Institute in the text chat, and one of the links is actually for the Unity Roadmap Gauge. That lets you assess where you're currently at with these different components and prioritize kind of where you want to focus. So that's also something that you can check out, though do note that it was created more for community violence prevention audience. So I'd like to move into introducing Matthew. Matthew works at the Missouri Coalition Against Domestic and Sexual Violence and joined the staff there in 2012 as a program development specialist with a focus on prevention programming. He has experience in community organizing and education, policy, and program development, having developed programs on capacity building, policy implementation, and sexual health promotion. He gained valuable experience first at the University of Missouri's Women's Center and next at True North, first as a victim advocate and later as the Youth Outreach Coordinator. Matthew, do you want to say a quick hello?
Hello.
Hi, Matthew. So I'd love to hear from you. How did your agency start to prioritize prevention work?
Hi, Alicia. Thanks for that introduction. So, I have to say, we got started in our capacity building for prevention about a decade ago, whenever we participated in the Delta Prep program. And I'll go a little more into detail about that in a moment. But first, I really wanted to share that so much of our work here at the Missouri Coalition towards prevention is really rooted in social change. And so I wanted to share this slide in quote, and it's a slide that we share in our Prevention and Social Change, the Principles of Primary Prevention training that we do every year. And we really try to root our prevention work in social change. And so, Alicia, just like you had mentioned, whenever organizations really have the ability to make prevention and health equity a priority, then we can all better support social change and the social change necessary to end sexual and domestic violence. Here at MCADSV, we very strongly believe that primary prevention really is social change, and it's about changing those social norms that can allow and condone violence. So that means changing our society and our institutions, really working across the social ecological model to target attitudes and beliefs in individuals, but also really working to shape those environments and policies to eliminate risk factors that contribute to violence and work more on promoting safety and respect and equity. And this is social change work, and this is how we really root our prevention work here at MCADSV. So getting started, I want to recognize that the introduction I just gave to social change can be a bit heady and can certainly seem a little overwhelming, especially for folks who are maybe just getting started in their organization and really trying to figure out what does prevention look like for us as an organization. So like I mentioned, it's taken MCADSV nearly a decade to really get to where we are today. And we began by participating in the Delta Prep project. And I want to give credit where it's due to my friend and predecessor, Jenny Dills, who really led MCADSV through our internal capacity and really building our efforts to be able to work on primary prevention whenever we participated in the Delta Prep program from 2009 to 2011. I also want to recognize that participating in Delta Prep really helped us as an organization to get started, but it's also helped the field in general. And so what we learned through the original Delta program, Delta Prep, and now Delta Focus is able to really build on previous prevention work, and now we can have a very intentional focus, if you will, on really examining those social and structural determinants of health and really beginning to think about what does this look like for our organization to have the capacity to do this community level work. So beginning to think about prioritizing prevention, we go a little more in depth about this in our organizational capacity publication that you see here in the left corner, embracing prevention and social change. But a couple things that I really want to point out. Tools in the Delta Prep Kit helped us as a staff really define prevention so that we all had a shared language and understanding of what is primary prevention. And I think that's really important for an organization because if we can all have that shared language, it makes our work much richer and much more important for us to be able to talk to with any potential partners. The other thing that I think is really important is that we spent a lot of time really discussing what does capacity look like for our organization. And I think that's particularly important because before you can really begin to do any sort of strategic planning or thinking about next steps, you have to determine what organizational capacity really and honestly looks like for your organization. And that might be different for every organization. That's going to look different based on a variety of factors. And it also might look different based on new projects that you're going to be working on. But I think it's really important to begin with those two very clear aspects of defining prevention and organizational capacity, and then you can really move into developing your inventory of potential changes, determining those organizational changes, and setting some smart goals around those. But I really want to stress the importance of those initial steps of just defining what it means for you as an organization.
That's really helpful, Matthew, and I like that you're starting with getting that shared language and, not taking that for granted that already exists. What structures and processes has your coalition put in place to better support prevention?
That's a great question. I think one of the most important structures and processes that we've put in place is really being able to allow time at staff meetings to talk about prevention and our prevention efforts, allowing time to really talk about what are we seeing with our member agencies, what are some really innovative things our member agencies are working on, and being able to lift up their efforts and highlight them as well, and share those with others. And then I think, once again, going back to what you had just mentioned and that we've been kind of talking about, making sure that everybody has that shared language among staff, among your board, among your leadership, just having that shared language and not taking for granted that everybody knows what you mean when you're talking about prevention. Another thing that we've put in place is really embedding prevention into our mission. And so we went through a process a few years ago of looking at our mission and thinking about how we want to update it to better reflect the work of MCADSV as a statewide sexual and domestic violence coalition. And so with working with our staff and our board and a couple outside consultants, we really came up with this language that we feel like more accurately reflects our work. And so something to point out is that we very intentionally wanted to say it is our mission to unite Missourians with a shared value that rape and abuse must end. And so having an intentional focus about uniting others, bringing people into the work, and then saying how it's really shaped around that shared value that rape and abuse must end. And it's something that I've heard many of my colleagues say. It's something that I certainly say, but I'd like to work myself out of a job. And I think many people feel that way. And so being able to have a really strong mission statement can help to keep employees grounded in the work. And then it also lets your community and other allied partners know what it is you stand for. So it really does help to draw others in and have a very shared value in the shared work that you're doing. A couple other ways that we've really worked to incorporate prevention into our core areas. So I just shared our mission statement about uniting Missourians with a shared value that rape and abuse must end, and we advanced that through our core areas of education, alliance, research, and public policy. And we've worked very hard to incorporate prevention into all of these areas. So making sure that prevention is cross-cutting, that it informs all areas of the organization and our work. And to give a couple of specific examples for each of these, with education, we've incorporated prevention and then social change messages in all of our basics of advocacy trainings. We have a series of trainings every year for individuals working at our member agencies who are maybe new to the work, they're new hires, or they've been there for a little while and they want a refresher on some of the basics of advocacy. We work to incorporate new research, best practices every year, but something that we've been very intentional in doing is incorporating prevention and social change messages into every one of those trainings. And another thing that we've done is to incorporate social change into our service standards for our member agencies. And so making sure that whenever organizations come into our membership, that they understand social change. They understand the importance of having social change as central to their work as well. Then looking at alliance, really working to identify and engage other allies in our work. And you know, Alicia, it's something that you mentioned, maybe even they are non-traditional partners that we wouldn't originally think of, but by really looking broadly about what can we gain by bringing more people in, I think there's so much that we can identify there. And so we work really hard to also train our member centers on community mobilization and that aspect of drawing other people into the work, and that we're stronger when we combine our efforts with other allied professionals. Then whenever we think about public policy, our public policy team monitors legislation on both the state and federal level that relate to prevention, and we also work to really intentionally incorporate prevention in our statewide plans with other partners. And then whenever we think about research, we gather data from our member centers on monthly service reports, and that data covers the services that they provided each month to individuals who were reaching out to their programs, but it also really works to capture how many youth receive prevention programming across the state. So we try and keep a close eye on the extent of prevention programming happening throughout Missouri. Another quick example that I'll give is a couple of years ago, we very intentionally started doing a stronger outreach to college campuses. And so our campus work really started to include reaching out to partners in prevention, and that is a coalition of 21 public and private universities here in Missouri. And so that directly relates to alliance, finding partners who can help further this work. We have worked to provide cross-training between staff at our member centers and then staff on college campuses to provide networking opportunities for them, to provide cross-training for them. We monitor a lot of public policy efforts that also directly affect higher education, and so really incorporating Title IX very intentionally and how we can work with our partners in higher education to use Title IX to really further and bolster prevention efforts. And we've also worked with partners in prevention and then our partners in the Department of Health to really do more research intentionally around this. And so we've developed a multi-year research project with the three of us and then also the Truman School of Public Affairs at the University of Missouri to really look deeper into what does collaboration look like between campuses and community-based sexual and domestic violence programs. How can we help bolster those efforts? And really work to build much stronger connections and collaboration on that local level as well.
Thank you, Matthew. Yeah, it's really neat how you're thinking about prevention across all of your areas. We want to turn it over to a text chat question now to hear from the audience. So if we can just go to the next slide here. So I'd like to ask those of you who are participating today to share your agency's mission or vision. How does it or how could it support prevention? So if currently it doesn't, maybe if you have any ideas of how it could, or if you think your mission or vision already does, we'd love to see what it is. So please share that in the text chat, and we'll come back and share some examples in a few moments again. So Matthew, you know, we really like how you're embedding prevention into all your core areas, and I'm sure that has implications for your staffing and training and all that kind of thing. So I'd love if you could share what embedding prevention into your core areas has meant for staffing, and how do you make sure that everyone is up to speed?
Yeah, absolutely. So really it's by taking a team-based approach. And part of a team-based approach is considering, once again, how the agency as a whole is really able to support and implement prevention efforts. And so a few considerations to really keep in mind as we look through this list of leadership, structures and processes, staffing, partnership development, resource development, and then community development. When we think about leadership, really beginning to look at how you can make sure you have buy-in from your board and executive leadership. Really being able to work with them so that they feel comfortable and confident in talking about prevention and social change. So making sure, once again, that we have that shared language and we feel comfortable talking about it. I know that I saw a question kind of come through in the text chat about maybe what some of those messages mean. And when we think about social change messages, it really is taking a very positive way of talking about we are, once again, here in Missouri, working to unite others with that shared value that rape and abuse must end. And so really taking social change and strong language like that around uniting people in the work and making sure that whoever is really talking about it in the organization feels comfortable and confident in it. Then looking more into structures and processes, being really intentional about how prevention is part of your organization's strategic planning, that you have devoted time in staff meetings to talk about it, that you incorporate information on your website and any of your marketing materials about prevention and social change. And even looking at, whenever you look at job descriptions, making sure that you have employee value statements that talk about a commitment to equity and a commitment to social change. And I think that those are really important because, again, it makes sure that you have staff buy-in. If staff know that a big part of their job is about promoting equity and working towards social change. Then thinking a little bit more about staffing, it's really important to make sure that you do have that dedicated position to lead prevention efforts. And maybe it doesn't mean that you are, well, I think we all agree it's best practices and we want to see at least one person who is full-time devoted to prevention, still taking that team-based approach. So if you do have someone who works 80% of their time on prevention and maybe 20% on something else, they have a supervisor who also has dedicated staff time to support those prevention efforts. That prevention is incorporated into more of a team-based approach, so multiple people on your staff really know and understand the role that they have to play as well. Then whenever we look more into partnership development, again, kind of focusing on how it's not only important to make sure that we have dedicated positions in our organization, but thinking about, you know, sexual and domestic violence is a public health issue and its effects are far-reaching. So how can we identify and work alongside other allies in this work? And a way that you can kind of tie staffing and partnership development is working with your colleges and universities once again to really try and recruit interns who are interested in prevention, interested in public health and public policy, and making sure that we're also intentionally working to build a bench of people who want to join in on this work. And even if they aren't going to be working directly at a sexual or domestic violence organization, they know the importance of this and how far-reaching it is. And then kind of thinking about resource development, working to include a specific line item in your organization's budget for prevention, thinking about what that realistically looks like, being able to identify what you need to make your prevention efforts sustainable and how you're able to sustain it as an organization. And also just mentioning, like it says on the slide, these efforts should be monitored, evaluated, and tailored, because the other thing that we know that we've learned both here at MCADSV and in working with our member centers is that life happens and things change. And so to use our organization as an example, my position here has changed over the last 6 years that I've been here. So like Alicia mentioned in my introduction, I started as a program development specialist with a focus on our prevention efforts. As I've been here, my title and job responsibilities changed to be prevention director, and now they've changed again to be public affairs director. So while I've always been our staff lead on our prevention efforts, we've also just gone through changes as an organization. And so part of that sustainability is really thinking about, if you are an organization that you know is going to be changing and growing, then how can you sustain those efforts and really embed them? And something else to kind of mention and think about here, I want to give credit to my partner over in the Department of Health, Sarah Earhart-Reed. She and I have talked a couple times about retention as prevention. So thinking about how you're able to retain staff, how you're able to make sure that you're not having turnover in the position for the person who is going to be leading these efforts. And that's something that we've really been thinking about here internally at MCADSV, and what that means for our member agencies, what it means whenever we start talking about our member agencies working with other allied professionals, and how can we be really intentional when we think about retention as prevention, retaining our staff so we can make sure that our efforts are sustainable over the long run.
Yeah, that's really important, especially since a commitment to prevention can take time, and getting that buy-in takes time. And you said that you've been doing this for, did you say a decade maybe? So yeah, I think that retention of staff can help with retention of prevention efforts as well. Let's turn it back to the text chat and see what's coming up. We've had a lot of people share their missions and what's the other one? Visions. Missions and visions. And it seems like a lot of them have both themes of healing and supporting survivors, as well as ending sexual and domestic violence, and really supporting prevention. So that's really great to see. Ashley, do you want to share anything?
Yeah, well, I was really impressed with everyone's knowledge of their missions and visions, first of all. But yeah, Alicia, there was a lot of language around ending violence, reducing incidents, stopping violence, working towards the elimination. And then on the flip side, there was promoting safety, creating equal and respectful relationships. I think there was, I want to say it was making sure that New Zealand is the best place in the world to raise children. I like that one. So those were, there was a lot of, if we are really being true to our mission, there's definitely, we're preventing violence, and we're really working towards that social change.
Great. So now that we've shared a little bit about that, and we started to talk a bit about staffing, I know another area of buy-in that can be important is board of directors. So Matthew, I'd like to ask you, was it difficult to get your board of directors on board with prevention, and what recommendations would you have for others?
Yeah, absolutely. That's a really great question and consideration, I think, for every organization. If you're a coalition, if you're a community-based organization, but typically we all have a board that really directs and guides us. And so once again, I'll kind of take it back to, again, making sure that everybody has that shared definition and language and feels comfortable and confident in it. And then I also just kind of wanted to share the structure and makeup of our current board. So many domestic and sexual violence coalitions are moving in a direction of having community members serve on their board alongside representatives from their member agencies. And we went through this process a few years ago, largely in recognition that we have to expand we have to expand our sphere of influence to include multi-sector partners. So again, really making sure that we're going back to our mission of uniting Missourians and bringing more people into this work with us. So we have a board of directors, and then we have our membership committee. Our membership committee is comprised of representatives who are working at our member agencies. And then we have a blend of board members and program members as well. And so you can kind of see some of our different standing committees there. But mainly what I wanted to share this slide and share is that I think it's really important that we consider how we're bringing in community members and how we are working with multiple sectors to really further our work and advance ending sexual and domestic violence, and really working to promote, again, safety and respect and equity in all of our work. So to talk just a little bit more about gaining support from board of directors, I wanted to share this picture from our conference that we had a couple of years ago. And you can see a couple of our board members represented here, both from our member agencies and then from the larger community as well. And I think it's really important to just kind of highlight that by including people with different roles and perspectives, that MCADSV is now in a position to further our prevention efforts by really working to expand our network of allies. And so to give an example of that, we have a board member who is from one of our member agencies, and it's a domestic and sexual violence program. They have a shelter that they operate, and the actual property where the shelter was built was donated by someone from the community. Well, the people who donated that property, their grandson has been very involved with that program, supporting that program. And so our board member, who is the director, introduced us to this person whose grandparents donated that property. That individual now works at the Missouri Chamber of Commerce, and so he now sits on our board as well. And working with him, it also got to a point where we were thinking about how if we're doing such a very intentional push to expand our efforts out to campuses, maybe we should consider having someone on our board of directors who is also really involved in higher education here in Missouri. And so our board member who came on and works at the Missouri Chamber of Commerce introduced us to someone who works at the Missouri Coordinating Board for Higher Education, and she recently came onto our board. So kind of thinking about using your board for networking. If you're really looking at furthering your prevention efforts, who are those champions on your board who love what you're doing and are very excited about what you're doing? And then how can they use their networking to really bring in additional people too? I think that that's just a really important thing for us to think about in our work, is how do we continue to bring in new voices, new perspectives, who might have just a different perspective in the work, but what can we really gain from that?
Thank you for sharing that. I think that's really helpful to hear how you've been gaining support and including community members on the board, which I think is really fantastic. What are some other areas of work that you're prioritizing, and how are you going about that?
So with the Delta Prep capacity building tools that we got in 2009 through 2011 through participating in Delta Prep, we've used those same materials to really help build our own efforts towards promoting health equity in other areas. So as an organization, we maintain a commitment that every individual deserves the opportunity to achieve safety and equity, and we also acknowledge that there are structural barriers to achieving this. So whenever we look at things like sexism, racism, homophobia, income inequality, these more structural barriers, we also have to recognize how all of those intersect and how they will affect people differently. And this helps to keep us really focused on our commitment to social change. So we've used those same tools from Delta Prep to very intentionally work as an organization around our organization's anti-racism and racial justice work and what that means for us. Similarly with our anti-oppression and LGBTQ equity work, and then also with our language access work, and more recently, really expanding that out to sexual harassment. And so part of that work is, once again, defining what capacity means for our organization. And so what can we as an organization be doing internally, as well as how are we able to build our capacity to really create leadership opportunities for others at our member centers and foster a bench of people who are ready to really kind of lead us as a state in the work based on what they're doing in their local community. And I think that's so important because, once again, we have really innovative work happening here in Missouri, and as a coalition, we want to make sure we're able to amplify that. So whenever we know that there's a program doing really great racial justice work, when we know that there's a program that's working towards LGBTQ equity, whenever we see that there's a program doing really innovative work on the community level to work with their community partners on updating policies around sexual harassment and workplace safety. And then also we recently got feedback from our membership committee about better and more sustainable ways that we as an organization can help them provide language access in meaningful ways for survivors whose primary language isn't English, but meeting folks where they are. And so even in all of this, we, if it isn't directly related to primary prevention, it still has a health equity approach because we recognize the importance of really being able to make sure that, once again, everyone deserves that opportunity to have safety and equity. And so what are the things that we can be doing as an organization to promote that and promote our members as well?
Yeah, that's really great that you're thinking about these different areas with language access or anti-racism, and thinking about even how those intersect with prevention. So I'm really happy that that's happening in Missouri right now. We don't have too much time because I want to make sure we can get to our next guest, but you've been doing some really innovative work around getting your member organizations ready to take on prevention. How have you gone about this?
Yeah, so just quickly to kind of talk about another way we have worked on our members' organizational capacity is by incorporating prevention and social change into our Executive Directors Academy. And this was a program that we started in 2012 and opened it up to executive directors, CEOs, program managers who are in their first, either first to third year of being in that position. And we've changed the structure slightly each year based on feedback from each cohort, kind of based on where we see our members are at the time. But what we've really tried to do is have a very intentional focus on capacity building for our member organizations to have primary prevention and social change efforts incorporated into their organization. And so, again, kind of looking at that retention as prevention, if there's a new program director who's in their first to third year in the organization, how can we be working with them to make sure they understand social change and they're incorporating it? And so while you can kind of see on here that part of the things we offer in Directors Academy are trainings on funding and board development and staff management, we also have very intentional training and time devoted to public policy and media advocacy, community partnerships, and social change, and how all of these things need to be a really important part of your organization as a whole. And that's something where, again, if you have that leadership and buy-in from your executive directors, and then they understand how to talk about prevention and social change to their board, it can be much more sustainable for them as an organization as well. So to give a quick example of one of our member center profiles, the Metropolitan Organization to Counter Sexual Assault, MOCSA, their CEO was hired and went through our Directors Academy, and then she led MOCSA staff and their board through strategic planning with a very strong and intentional focus on prevention. And now their CEO currently serves on our board of directors as well, and so she brings a really great perspective of one of the only standalone rape crisis centers, as well as an organization that's worked really hard to incorporate prevention at the same level as all of their other work. So with that, I want to be able to turn it over to staff from MOCSA, who I also just kind of want to mention, Melanie actually participated in part of our Directors Academy series as well. So really taking that intentional focus of program leaders can learn so much from being brought into these discussions.
Thank you, Matthew. That's the perfect transition to introducing our next set of guests who work at MOCSA. And we'll be bringing Matthew back at the end for a little discussion on challenges and tips. But I would like to introduce our next set of guests. I'm just going to advance my slide here. Melanie and Vanessa. Melanie is a Director of Education for MOCSA. Melanie holds a master's degree in public health and has been working in the field of sexual violence prevention for 7 years. And Vanessa is the Community Prevention Coordinator for MOCSA. She holds a BA in Political Science from Truman State University and has more than a decade of experience in policy, advocacy, coalition development, and community organizing. From the lead-in Matthew provided, I know that your executive director has really helped with building organizational capacity for you in Kansas. Can you please share more about this pivot to prevention? And sorry, feel free to introduce yourselves as well.
Sure. Hi. So this is Melanie, and Vanessa's with me as well.
Hi.
Hey. So yeah, I'd like to share first just a little bit about MOCSA, just to give you a basic understanding of the services that we provide. So we have a 24-hour crisis line. We provide advocacy to victims of sexual violence, and then we have counseling, and then we have our prevention and education services. And we see probably through all of those services around 65,000 people throughout our metropolitan area. So we serve 6 counties total between Kansas and Missouri. So that's also kind of a unique, I think that's a unique part of our organization and service area, that we're serving a bi-state area as well. So just something to keep in mind for us. So really how we'll start off is just talking about some of our programs. So historically, for MOCSA's prevention education program, we provided education services only. And we provided education from kids to adults. So we did a program called Project Aware, which talks to kids about bodily autonomy and safety, and safe and unsafe touches. We also have education that we provide in middle schools and high schools, and currently we serve over 30 school districts in our metro area with our various educational presentations, which include, talking about sexual harassment or consent or sexual assault, healthy relationships, those kinds of topics. And then we also have training for adults, whether that's talking about child sexual abuse, sexual assault, how to respond to victims, talking about trauma. So really that's what MOCSA did for years and years and years. And so as Matthew had mentioned, our CEO, who's not new anymore, but 6 years ago she was new, she went through that Director's Academy and she was really interested in kind of ramping up our prevention efforts. And that really led us to starting building up our prevention program. So you can see on the slide here, I try to put the years that we added these other prevention programs. So we really started doing community level primary prevention work in 2014. We have a school-based program that we do called Strength Clubs. We started doing that in 2009. We do the Green Dot Middle School program. We started that in 2014, and then we developed a youth-led prevention program for high school students, and we started that in 2015. So you can see as part of building up our prevention programs, we've added several programs that are focused on primary prevention of sexual violence.
That's great context. Sorry, were you going to say something?
No, go ahead.
Yeah, I was just going to say that's really great context and really shows the importance of having that high-level leadership being committed to prevention as well. And I really like this slide and being able to see kind of the evolution of work within the education department. So I'd love to hear more of how did MOCSA leverage this momentum to continue building organizational capacity for prevention?
So as you can see, I have some of our capacity building steps that we went through, and we really, I have it second here, but we held a visioning session, and by we, I just mean it was like myself and our CEO and our Vice President of Operations and some of the other education staff members. And we really said, what do we envision our prevention programming to look like? What do we want it to be? How many staff do we think we need to hire? How do we need to ramp things up? And that was really, really helpful. And it actually was really inspiring to me because after we had that visioning session, I actually saw some of the things we talked about in that session come to life in the past, within the past 5 years. Those things started happening, and I really attribute it to just having that initial vision of what we wanted. What is our end goal here? So with having that, also an important piece of the process is back in 2015, or I guess back in 2014, we started a strategic planning process for our agency. And in that, we have a huge focus on doing prevention work. So now doing prevention work is part of our agency strategic plan. We had that visioning session for the education department and how we planned on growing that. So from there, we really started talking to funders, both government, private foundations, and whatnot, about the programs that we're interested in doing and about just getting funding for prevention work, because there's not a ton of funding out there. And I do want to take just a step back for a second, too, and say that even before we started doing this work, we were lucky to have, our state coalition who was already talking about prevention work and helping, their member agencies to build their prevention capacity, and having that same framework of prevention. That was very helpful. And I actually attended the Prevention of Social Change workshop, I guess, that MCADSV does, and that was just nice to have the same language and framework to work from. So that was really helpful. And then some of our state funders through RPE, they have also started looking at doing, I think, more community-level prevention work and doing primary prevention programs that are evidence-based. And that also was kind of happening at the same time. And so that is a piece of the puzzle and what helped us to move forward, I guess. So, but we started talking to funders, and then we had to do education with our board members. We had to do education internally with staff members because it's really a shift to go from what I would say more of a feminist perspective in working on sexual violence prevention only to now also talking about public health and violence prevention and working from a public health framework. It was helpful. It's helpful. I have a master's in public health, so that was super helpful in helping to provide education internally into our board about what are the public health approaches to violence prevention and how are we incorporating that into doing our prevention work here at MOCSA of sexual violence. And so I did, education sessions just specifically on like what is the social ecological model and what is the public health approach and what are shared risk and protective factors when it comes to sexual violence and other forms of violence. And that took a while to get people on board. And also we had to do some education on what is individual prevention work look like versus doing community level work, making organizational environmental policy change. That looks a lot different than doing individual education, not only for our staff, but for our community as well, helping them to understand the difference as well. So those are some of the steps that we took in just building capacity for our prevention efforts.
Thanks, Melanie. Yeah, it sounds like this really resonates with the things that Matthew was sharing around building shared language. So I just wanted to say, it's nice to see how it's similar and how you've been able to leverage some of the work that's happened at the state level to help inform your work.
Yeah, and if I can add really quickly, with our mission, we actually changed our mission as well. I think it was around 2013. And so our mission, while it included prevention and education in it previously, our new mission, which you can see now, having that to prevent sexual violence in our community, we were very intentional about that and making that known that is our mission. We want to end sexual violence. We want to prevent it, and that's important to us, as well as doing our counseling and our advocacy and serving those impacted by it.
Thanks. Yeah, it's very explicit in this mission, so that's nice to see. Now, Matthew talked a little bit about staffing and staffing structures and retention, and that seems to be an important part of building capacity. So would love to hear about how, for MOCSA, hiring, recruiting, and staffing structures have changed as you've prioritized prevention.
Yes, I'd love to talk about that. I'm actually going to skip ahead a slide, but I'll come back. So this was our previous staffing structure when I started as the Director of Education at MOCSA. So there, I manage a team of 5. And as I said before, all of our education outreach specialists, they were doing individual level education from kids to adults in the community. So back in 2013, this is what my staff looked like. So as I said, we've been ramping up our prevention efforts, adding programs. With that comes adding staff. So our current staffing structure, I have 4 coordinators now who manage 4 different programs basically, and a total of 12 staff that I work with now. So we still have our education. That's still that's a very important step in preventing sexual violence, is having that individual education out there. So that's important to us, and we are still committed to doing that in our community. We also have added a community prevention coordinator, Vanessa, who you will hear from, and she does community level prevention in one of the counties that we serve and runs a community coalition, and she'll tell you more about that work in a little bit. And then I have a coordinator of prevention who does all of our school-based prevention work, so our Green Dot program, our youth-led prevention, and our strength clubs. So she and her staff run all of that programming in our community. And then this year, actually, which isn't so much about prevention work, but this year we did move our volunteer program over into my department. Our volunteer program used to be managed by our advocacy department, but we moved it over to our education department to work on recruitment of volunteers for our agency, so it just made sense to make that move. So you can see we've, I just think about it sometimes now. It's challenging to go from 5 staff to 12. So, that's been definitely one of the challenging things about growing our prevention programming. But I can talk really quickly about the hiring and recruiting process. One of the things that we did is we started a bachelor's level internship program specifically for our education department. And that was really important because, we oftentimes get really great volunteers and interns that come to MOCSA, and they're really great candidates for when we're going to hire new positions at MOCSA. So that was really helpful because then we can start training people to do, our education programming specifically at MOCSA. So that was a piece of ramping up our prevention work. We created some part-time positions for our education specialists, and so we used to just have them do full-time work, but we decided, well, we want to try what would it look like to just have folks doing education during the school year only and then on a part-time basis. And so we've been doing that for several years now, and that's really helped us as well to maintain our level of service, but then to not necessarily have to maintain full-time positions for all of that work. So we could move some of those resources over to our prevention programs. We started including primary prevention information into our volunteer training. So we have a 40-hour volunteer training that we do, and we made sure that we started talking about our approaches to prevention and the public health approach to prevention. We changed our job description, so we created a prevention specialist position. So that's been a new position for us since 2014. And then we also have one person that is fully, her position, Vanessa, who you will hear from, she is fully dedicated to primary prevention on the community level. And most of our staff members have other work part-time on our crisis line and doing advocacy for us, about 10% of their time. So, it's really awesome that we have a full-time dedicated person to doing that prevention at the community level. So that's something else that we kind of ramped up and did that was unique. So those have been our hiring and recruiting strategies.
And I think it's important to note that it wasn't an overnight thing, as you mentioned, like the transition of getting from your old staffing structure to now, took time and really took that commitment to prevention and all the different capacity building steps you took. So yeah, I think that we would love to hear from Vanessa now about, with this whole focus on prevention that you've been having, what have you really been able to do at the community level?
Yeah, so hi everybody. We have, I think, really been able to make some important strides in our community level programming in a way that I think is pretty innovative. So I'm really excited to be able to share with you what we've been able to do. And I also think that it's important, I'll say this now and I might say it again, the strategies and the structure that we have identified for our work in Wyandotte County is really specific to the needs and resources and landscape of our community there and our coalition partners, and work that you do in your community could look different, and that's great. So to give you a little bit of background on Wyandotte County, so if anybody's familiar with the Kansas City metro area, I'm talking about the Kansas City, Kansas side. And so it is a very diverse urban community. It's a little bit smaller on the population size, just the way metro areas and municipal lines work out. It's about 160,000 people. And some of the reasons why we chose to pilot this community level prevention program there, one, there's, I would say, a high degree of readiness among the community. So it's a part of the metro area that experiences consistently high rates of violence and also has a lot of health outcome needs. There's been, when you look at Kansas as a whole, Wyandotte County, always comes up with fairly poor health rankings as it compares to the rest of the state. So there was a lot of existing and potential partner organizations that were already working on community health outcomes, equity issues. The local government had already identified some of these things as issues that they were working on. Residents were getting mobilized. So those are some of the specific factors to that community that we sort of were moving into when we started this program. Another reason why we started doing our community work in Wyandotte County is because we had an existing community coalition that had been in existence for more than a decade that had been primarily focused on awareness and education efforts. So they were the folks that would help plan community events during Sexual Assault Awareness Month. They helped facilitate relationships with the local school district and programming. And it was in 2014 when we came to this back to this community advisory board and started talking about how can we make a shift from education and awareness to primary prevention. So just as Melanie talked about how we need to do education about what that means and some real visioning about what that means with your staff and board, we had to do that same thing with our community partners and coalition members. And, so I think that takes some time to do, but we ultimately have a lot of really great buy-in from those coalition partners. So the folks who are at the table there include the health department, the school district, the police, a number of social service providers, including mental health providers, the local DV program, the community college, KU, and resident groups, the neighborhood association. So once we identified that primary prevention was what that group wanted to focus on, we actually changed the name from the Wyandotte County Advisory Board to the Sexual Assault Prevention Coalition, WICOSAP. And I think that we probably have a fair amount of recognition of that coalition name happening in Wyandotte County now. So we did a needs assessment. We contracted with an evaluator from KU, and she helped us to do a needs assessment on community's experience of sexual violence. And out of that, we identified two main strategies. One was addressing environmental factors in the community that were leading residents to feel unsafe. So in Wyandotte County, there was a lot of issues with poor maintenance of things like street lights and sidewalks and curbs, tree trimming, related to, in particular, empty lots or abandoned or empty buildings. And so those, and I know that that's not an issue that's completely unique to our community, but I also know that that might look different in other communities. But what residents in KCK identified was environmental factors in their neighborhood led to a feeling of unsafety, which in turn made people less likely to engage with their neighbors, to utilize parks, to engage with community services and resources. So we identified crime prevention through environmental design, SEPTED. If you Google that and you want to do some research on it, it's a strategy of addressing physical environmental factors to reduce crime and violence and increase feelings of safety. So we have been working with coalition partners that particularly have been interested in working on physical activity, so folks who are working on improving those community health outcomes through utilization of parks, biking and walking. Working with those partners to implement MCADSV strategies through their work to not only improve people's physical activity, but to improve safety in those neighborhoods and to increase the likelihood that people will engage with that health improvement programming. So that's one strategy that we've identified. The second strategy that we identified was that while there were a number of partners that I mentioned who were working on issues related to violence prevention and health improvement, there was not a concerted or centralized plan. Wyandotte County and KCK did not have a community violence prevention plan the way that a lot of cities do. And so our coalition said, that's fine, we'll be the ones to do that. We'll take the initiative. And so we initially said, we're going to get together a panel of stakeholders, we're going to start drafting a plan, and we're going to advocate with the local government to adopt a violence prevention plan. And you can see the three main focus areas that we identified. So based on our needs assessment and feedback from community members, we had foster safer violence-free neighborhoods. So addressing neighborhood violence is a means of reducing overall violence. Promote and foster community connectedness and support, and addressing cultural norms that support and promote violence. So things like victim blaming or encouraging bystander behavior. Simultaneously to us taking on the violence prevention planning process, the local health department was doing their community health assessment. So some of you might be familiar with your local health department's efforts in this area. Some of you might not. Most health departments have to take on this process periodically as part of their accreditation process. So the health department did a community health assessment of asking residents what they felt were the biggest issues related to health in their community. And one of the four focus areas that the health department identified was violence. The others were access to safe and affordable housing, access to economic opportunity, and access to health care, including mental health and dental care. So those of us who work in violence prevention see how all four of those things are related to each other. And because we had already created a really positive working relationship with the local health department, and they were aware of the violence prevention planning efforts that we had already undertaken, they asked us if the violence prevention planning work that the YCOSAP Coalition was already doing could become the violence prevention planning efforts under the Community Health Improvement Plan. And so now the coalition that we have convened is drafting policy that's going to be adopted and implemented by the health department as part of a 5-year community health improvement plan. And we're really excited about being able to integrate strategies about violence prevention in work that not only is going to be implemented by the health department, but by the health department's full range of community partners and government agencies.
Yeah, I really like how you're talking about different partnerships that are important for this work, and really working together with the health department and others to address multiple forms of violence. So thank you for sharing how you're going about doing that with this really exciting and innovative work in Wyandotte County. I want to make sure that we have enough time to get to challenges. I know we only have 10 minutes left, so I want to bring back Matthew as well, and just want to advance my slide here. So we can talk quickly about challenges and tips from all of you. So those of you in the audience, I'd also love if you could share any challenges you've encountered in building organizational capacity for prevention and health equity. I don't think we'll have time to recap all of that orally, but would love to hear through the text chat any challenges that you've been having, and hopefully our guests will be able to share their reactions to some of similar challenges they've been having and how they've gone about addressing those. So I'd like to start with Melanie and Vanessa. If you could just maybe briefly outline maybe one or two, maybe three of these quickly of what some of the challenges you've been having in building organizational capacity for prevention.
This is Melanie, and I think really finding the right staff for our new positions that we created was a challenge for us, especially for the community level position. It took us a while to figure out what the right skill set we would need for that position, and really with Vanessa has wonderful skills in community organizing and really understands policy level work and change, and so having that understanding the exact skills we needed for the new positions we created was just, it was kind of challenging, and we worked through it. It took us a while. And then I already mentioned talking about educating people about individual versus community level work, and that took a while to kind of get everyone on the same page. And really just there's not like a clear roadmap for success all the time for community level work in the field of sexual violence. And so, you know, that's just kind of challenging because it's a little scary. But
you learn as you go.
Yeah.
So let's also hear from Matthew. Does what Vanessa and Melanie shared resonate with you? What are some of the challenges you've been having, and where do you see some opportunities in building prevention capacity?
Yeah, absolutely. I agree with everything that Melanie and Vanessa have said, and just to kind of reflect that again, as Melanie had mentioned, funding is often limited for prevention, and so something that I think is really important to consider as you are in those very early stages of determining organizational capacity, if you're going to start applying for funding, really begin thinking in the beginning, if I'm able to get this grant that it's 1 year, 2 years, 3 years, what is that going to look like if we don't get another grant after that? And so how can we make sure that we are planning for sustainability at those very early stages? Also, just like Melanie mentioned, there's no clear roadmap for community level prevention. And so sometimes prevention can seem invisible, and that can often be difficult to relay to other folks. So I would say certainly internally, begin developing those tangible markers of success and making those really smart goals and objectives, while also staying rooted in social change and recognizing that it just takes a while to get there, and that's okay, and be comfortable in that. And then looking at things like burnout and staff turnover. We know that burnout often leads to staff turnover, and other life factors can lead to that as well. So in thinking about self-care, more so as an organization and not just for individuals, you know, we have times here where we all try to go and eat lunch together as a staff. We really work to build support for one another amongst staff. And then also just thinking about support outside of our organization. So there are oftentimes, I'll send Melanie an email and ask, do you have 10 or 20 minutes for us to get on the phone and talk? What's this resource like? Is it working well for you? And just being able to find other people engaged in the work who can really be your support system as well and kind of talk you through things as they're coming up. And then again, making sure that internally you do have that supervision to help support the work as well.
Thank you. And I saw someone in the text chat writing about evaluating prevention strategies, and I remember when we spoke earlier, something that Matthew said was a marker of success for his agency is collaboration. So I thought that was an interesting, outside of just outcome indicators, to be looking at what are some indicators of collaboration and partnerships. So I wanted to kind of pull that out. And I'd like to end with some tips from MOCSA. Would love if you could share your tips, Melanie and Vanessa.
Yeah, sure. So this is Vanessa. I think that, and Matthew touched on it, Melanie touched on it. I think that having, when we talk about having like shared language and definitions, it's important. I think that we identify the difference between doing education work and prevention work and understand how those things are related. So knowing that our individual education work is important, but it shouldn't be the only thing that we're working on. And so how can we be doing policy and environmental change work in order to magnify that impact? Understanding the importance of community organizing, we wouldn't be able to do any of the work that we're doing without having a robust community partnership and coalition. And I think that community organizing is a really important skill to identify and encourage in your staff and think about while you're talking about capacity. Leveraging other violence prevention efforts in the community. So for instance, if your local health department is already working on violence interruption programming or working on youth violence or gun violence prevention, how can you work with those efforts to make sure that they're including sexual violence and domestic violence or child abuse in the violence prevention work that they're already doing? So how can you leverage existing programming? And when you have technical assistance available, super utilize it. So we have a great partnership with the University of Kansas, who's helped us develop a lot of our evaluation and have also been really great experts when developing evidence-based strategies. And I would say that the Prevention Institute has a lot of resources available through their website that are very useful. Some of the ones that we've used are the collaboration multiplier tool. Hey, there you go. And the connecting the dots article does a really good job of laying out shared risk and protective factors and how you can be working together across sectors to prevent violence.
Thank you for that. We have a couple of minutes left, so I just thought that we could share our last resources here. So again, the Delta Prep Toolkit, we'll link that again for you. Feel free to check that out. And then the Prevent Connect report from 2017, which we already shared. And sorry, I don't know why I'm skipping around here. And then the Minnesota Coalition also has, I found this resource really helpful. I read through it, Embracing Prevention as Social Change. So that's from Matthew's agency, and I recommend checking that out as well. So I will hand it over to Ashley to close us off, and thank you so much to Matthew, Melanie, Vanessa. You were all great, and I really liked how you were able to build off each other and how you're supporting each other's work in the real world.
Thank you, Alicia, and yes, thank you to all of our wonderful presenters, and thank you everyone who participated and who showed up here for this conversation. It's an important conversation and one that was directly kind of asked for by the Prevent Connect audience. So we hope that you found it useful. I think that, you know, there's certainly need to continue this conversation in other forums. So we will be sending you out an evaluation survey in the next few minutes. If you would take a few minutes to respond to that, we really appreciate it. We do read every single one of them and use it to inform where we go next. There's also a link to a certificate of attendance after you complete that evaluation survey. I will be making the recording of this session available within the next, if not the end of this week, by the beginning of next week, as well as a transcript of the text chat. If you need anything in the meantime, you know where to find me, but thank you all so much. Have a wonderful rest of your Wednesday. Thank you to the team here at Prevention Institute, and again to Matthew, Melanie, and Vanessa. Take care. This concludes our web conference for today.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault. with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CALCASA.org.